Welcome everyone again to the University of New Mexico Law and Mental Health Didactic Series, weekly discussions of practice and science by experts in behavioral health and the law. This is a series hosted by the University of New Mexico, Department of Psychiatry and Behavioral Sciences, along with the New Mexico Behavioral Health Services Division. I'm Anthony Perillo, the Forensic Psychology Training Director here in the Division of Forensic Behavioral Sciences at the University of New Mexico. For our talk today, if you have any questions for our presenter, make sure you enter them in the Q&A box anytime you feel comfortable. Do know that we do hold the questions until the end, and oftentimes it's not possible for us to get to all of them. If you are pursuing continuing medical education credits, there will be a sign-in sheet that's posted in the chat box shortly. And if you're pursuing APA continuing education credits, the link will also be in the chat box, but in the latter portions of the presentation. So keep an eye as the presentation is drawing to a close in the chat box for a link that you would use to access a survey. If the survey link is not working for you at that time, copy it and save it for another time. And make sure that after you complete the survey that you save your certificate. We don't have access to those after the fact. A recording and the PowerPoint slides for this talk will be available sometime later this week. And as a heads up talks for next week's talk in the series, we have David Prescott, who will be discussing the Good Lives model of forensic or correctional offense-related treatment. But let's get back to this week. I'm very excited and honored to introduce you to today's speaker, who'll be discussing considerations regarding the issue of expressing empathy in forensic evaluations. This is Dr. Cassie Brown. Dr. Cassie Brown is our current Forensic Psychology Postdoctoral Fellow at the University of New Mexico. She completed her Ph.D. in clinical psychology in 2022 through the California School of Professional Psychology at Alliant International University in San Diego. She has a background in research and clinical work concerning intimate partner violence, trauma-informed care, neuropsychology, serious mental illness, and forensic psychology. As our Forensic Psychology Postdoctoral Fellow, Dr. Brown assists with policy work related to forensic behavioral health for the state of New Mexico and also conducts court-ordered competency evaluations for our Second Judicial District Court. Her clinical interests include trauma-informed care, forensic evaluation, and evaluation and treatment of serious mental illness. In addition to her clinical interests, she has an interest in policy work related to forensic behavioral health and improving systems of care for individuals experiencing serious mental illness. Dr. Brown is simply just a stellar early career professional. I can say that as her direct supervisor. She has the skills, the drive, the collaborative approach you would want in a department. So Dr. Brown, Cassie, on behalf of us, we are excited to have you joining the series, sharing all of this information that you have about expressing empathy with the audience today. I will go ahead and throw it over to you.
Thank you so much for that lovely introduction, and I'm really excited to present today. It's wonderful working with Dr. Perillo and the rest of the team in the forensic division at UNM, and it's just been a fantastic training year. So I feel very fortunate to be here. So with that, I'll go ahead and get started. Let me share my screen with you all. Okay, and let me make sure I have this in presenter view. All right. Okay, so today we're going to be talking about empathic expression in forensic evaluations, clinical and ethical considerations. Now, just again, here's a brief bio about my background, like Dr. Perillo just talked about. These are the instructions in terms of receiving CE credits for today's presentation. And just full disclosure, I don't have any financial relationship. I don't benefit financially in any way from the information I'm going to be presenting today. And another disclaimer in that the views that are expressed in the presentation today are my own views. They don't necessarily represent the views, policies, or anything like that of the University of New Mexico. So for today's learning objectives, number one, after this talk, hopefully you should be able to describe how expressing empathy during a forensic evaluation impacts the people being evaluated, including their levels of disclosure of information. You should hopefully be able to assess how expressing empathy during a forensic evaluation impacts the evaluator as well as their impressions. And hopefully be able to identify additional ethical considerations regarding expressions of empathy in forensic evaluations. So first things first, how do we define empathy? I think that it is safe to say that for most things, often we have different definitions of shared words or terms. So I think it's always nice to start with a basic definition. I like this definition provided by Carl Rogers in 1975. And what he said is that empathy means entering the private perceptual world of the other and becoming thoroughly at home in it. It involves being sensitive, moment to moment, to the changing felt meanings which flow in this other person. So really sort of kind of assuming the thoughts and maybe the emotions and things felt by another. So how did this topic come up? So this topic came up earlier in my training year here at UNM in the fall during a supervision session with Dr. Perillo. I asked what his perspective was on expressing empathy during evaluations. And the reason I asked was because over the course of my training in graduate school, I had supervisors who had different perspectives on this very topic. That tended to be context dependent. And what I mean by that is depending on whether I was functioning as an evaluator at that particular training site or as a treatment provider. So I had a situation at one of my training sites where I was conducting a neuropsych assessment. And it was one of the first times I had conducted one of those assessments on my own, but my supervisors were kind of doing live observation. And there was feedback that I received at the end of that, which was, try to kind of curb the expression of empathy a little bit. You shouldn't be kind of joking around or making a lot of conversation in between testing with the individuals. You really want to protect the way that you are administering the assessments and make sure that it's uniform. And so you want to be careful about any kind of side conversation in between. Again, expressions of empathy, laughter, things like that. You want to just really monitor those things. Well, then the following year, I was at another training site, and my supervisor had said to me during one of our individual sessions together, you really seem to have a knack for being intuitive with other people, and you really seem to empathize well with the patients. As an aside, I'll probably use the term patient, client, things like that interchangeably. So just kind of depending on what terminology you use in your practice. When I say patient, I'm referring to patient, client, just simply the individuals that we work with, whether we're working in treatment or evaluation. But anyway, so the supervisor had said, I think that could be clinically useful. And I think that you should really kind of explore using empathy with the patients. And I think that will help you build good rapport. I think that will help with your treatment relationship. And I think that it will just help the population that we serve here really feel heard and understood. This is largely a population at that particular place I was working with, individuals who are inpatient at a psychiatric inpatient facility. And to the supervisor's point, these are individuals who often don't feel heard and don't feel understood and are largely misunderstood by the larger society. So I really encourage you to use that empathy in your patient work here. So then I was kind of left wondering, well, how does the general public, in terms of people who work in this field, how do they approach their levels of expression of empathy when they're working with patients? So that's kind of how I initially arrived at this topic. I want to point out that there's a lot to be said about how we can use receptive empathy in our work as well, and how receptive empathy can also impact our findings with our patients. It can also impact our feelings, what we take home with us at the end of the day. And when I say receptive empathy, I mean that empathy that we feel internally or that we think internally. This talk is going to be focused on expressed empathy. So the actual expression, verbalized empathy during forensic evaluations. So first, I'm going to talk about the effects of empathy or empathic expression on the individuals that we actually evaluate. There was a seminal paper written on this topic by Daniel Schumann from the Southern Methodist University School of Law. And Schumann talked about the use of empathy, particularly in forensic examinations, and some concerns that he had about the use of expressed empathy. Overall, these were his main concerns. His concerns that an examinee might misinterpret their relationship with a forensic evaluator as being more of that psychotherapeutic relationship versus a relationship where someone is being evaluated. There's no kind of shared therapeutic goal there. Treatment is not the goal. Intervention is not the goal. It's really strictly evaluation, especially in a forensic context where it's a legal and often court-ordered evaluation. Schumann's concern, again, was that the examinee might misinterpret this. That misinterpretation of having a therapeutic relationship with the evaluator might then encourage the examinee, whether they realize it or not, to disclose more information than they might otherwise disclose. And then ultimately, the concern would be that in over-disclosing information, they would in fact be at risk of violating their Fifth Amendment right to avoid self-incrimination. Schumann pointed out in this article that, yes, he acknowledged we do provide informed consent at the beginning of these evaluations. We do discuss the limits to confidentiality in forensic evaluations. The limits to confidentiality in forensic evaluations, as some of you might be familiar and some of you might not, they do look different than the limits to confidentiality in, say, a psychotherapeutic relationship. Often in a psychotherapeutic relationship, unless the individual is disclosing information about things like child abuse, older adult abuse, active suicidal ideation, things like that, unless they're really disclosing things of that nature, the things that are discussed between therapist and client or patient or whatever terminology you use would stay between therapist and patient. In a forensic evaluation, the information is not confidential. So this information is often sent to the courts. Just to keep things consistent throughout this presentation, when I talk about forensic evaluation, I'm going to use the example of competency evaluations. Those are the types of evaluations I'm most familiar with, so they're easier for me to talk about, but this information does apply to other types of forensic evaluation and maybe other types of psychiatric evaluation in general. But the limits to confidentiality look different. So for example, if there's a court-ordered competency evaluation, always letting the evaluees know at the beginning, this information isn't entirely confidential. The information is going to be summarized into a report. That report is going to be viewed by the court. So the judge, your attorney, the opposing attorney, things like that. Schumann felt like this was not enough. That initial warning at the beginning of the evaluation is just not enough. And that's not enough to prevent an evaluee from potentially, again, aligning with the evaluator and over disclosing information. Schumann also pointed out that forensic specific stressors create an increased need for trusted confidants. So often when we are working with forensically involved individuals, if they are in custody, for example, they might have developed some guardedness around the other detainees at the facility they're staying at, other patients they're staying with if they're at like a state hospital, for example. And also there are a lot of stresses for them just by being involved in the legal system. They're worried about their case. They're worried about the ramifications of their case. Often there's a lot of guilt and shame that comes along with being involved in the forensic system. So Schumann's point to this was because of all those forensically oriented factors, the individuals that we work with when we're conducting forensic evaluations actually have a greater need for a trusted confidant. So even though they've received this warning, based on that need, they still might be inclined to disclose if they feel like their evaluator is a trusted other. And then Schumann also highlighted that due to the nature of work and training, evaluators are just you become naturally skilled at helping people discuss uncomfortable topics. So almost without even realizing it, because it tends to become a second nature, It could be that the way that we're trained and the way that we work within this arena has kind of primed us to come across as somebody who might be more therapeutically aligned, as opposed to strictly an evaluator in these contexts. I love this quote that Schumann included in this article. And I love this quote because I think, and speaking for myself at least, when I think about empathy in general as a concept, kind of assume that it's always altruistic, right? It's always a good thing to have empathy for other people. Empathy creates good. And that can be true, but not necessarily. So here he says in the abstract, empathy is neither positive nor negative. A therapist may use empathy to help a patient, and a car dealer might use empathy to sell a car. So empathy is just empathy. There's not necessarily any meaning assigned to it unless you're intending to use it for a particular purpose. In summary, these were some concerns that Schumann had. So the use of empathy in forensic evaluations, he highlighted, is specifically an ethical issue due to the nature of the involuntary relationship between forensic evaluator and evaluee. So for example, when I conduct court competency evaluations for the Second Judicial District here in New Mexico, the court is the client that I'm working for. The court is the one who has ordered the evaluation. It's court ordered. The evaluee did not come to me and say, I want an evaluation for X, Y, and Z. So that presents a type of involuntary relationship. There's also lack of a shared common goal in forensic evaluations. That's not to say there aren't maybe some overlapping goals. So for example, say I'm evaluating somebody for competency to see if they're ready to move forward with their case. And that person really wants to get this over with and move forward with their case. And I want to get my evaluation over with and get sent off to the court because that's my duty. So in that sense, there can be kind of a little bit of a shared common goal, but it's not the same as in a therapeutic relationship where you're really kind of establishing those goals at the beginning of the treatment relationship, and together you're working towards those goals. Again, like I discussed, the limits to confidentiality look different. Also, judicial proceedings are by nature adversarial. So that presents a difference that might play on ethics. And then finally, the influential capacity of the examiner on the proceeding. With forensic evaluations, we are asked to answer a legal question. That means that our opinion and our assessment and our opinion of the question might potentially lead the court to make certain decisions in the cases for these people. And then that, of course, has an impact on the whole proceeding and ultimately on the person that you're evaluating. So to summarize, these were kind of the main issues that Schumann pointed out in terms of ethical issues that might arise when we're conducting these evaluations and in the ways that we might express empathy. Brodsky and Wilson wrote a paper or published a paper in 2013 that was a response to this initial Schumann article. They did agree with some of the points that Schumann made, and then they had differences of opinion as well. So I'll get into those. So Brodsky and Wilson highlight 4 different types of empathy and the risks and benefits to each. By affective empathy, what they mean is really feeling the emotions that other people feel. One of the risks that they propose in expressing affective empathy is it might introduce bias for the evaluee, and it's similar to sympathy. Benefits they proposed is that expressing affective empathy to an evaluee might lead them to become more open, confide in the evaluator more. They might feel comfortable, less likely to malinger, maybe feign some symptoms. Although the greater openness here could include disclosure of incriminating information with the potential to harm them. They also discuss behavioral empathy. Now, in terms of behavioral empathy, that would be things like the ways that our behavior, maybe our body language, things like that, convey the feelings of empathy that we have towards the evaluee. One of the risks that they highlighted might be that, or would be that you might be giving the impression by expressing behavioral empathy, that you are helping and that you're on the side of the evaluee. When in your role as a forensic evaluator, we're meant to be on nobody's side. We're meant to be an objective party that comes in to conduct an evaluation. Although one of the benefits they point out might be an acceptable form of behavioral empathy, for example, might be referring the evaluee for therapy and immediate assistance due to expressed like active suicidal ideation that came out during the evaluation. You might reschedule an evaluation if the person is just not mentally well enough to participate in that, handing them tissues for crying. So these behaviors that you can take might not necessarily be inappropriate. Cognitive empathy here, what they mean is much like affective empathy, you're feeling the emotions of the other. With cognitive empathy, the idea is that you're really putting yourself in the same headspace as them, maybe experiencing some of the same thoughts, understanding that person on a cognitive level. A risk they highlight is there's a small risk of feeling an emotional identification with the person you're evaluating because you are sort of promoting this increased understanding of their situation. But a benefit might be that it could help an evaluator consider all sides of an issue. So it's likely to reduce the influence of cognitive heuristics and bias. The one I really want to focus on here is the expressive empathy. So expressive empathy, again, is the subject of this talk. It's the way that we verbalize empathic feelings or thoughts that we're having towards an evaluee. And a risk might be giving the impression that the evaluator cares for the evaluee in a psychotherapeutic manner. But a benefit is that expressing some empathy can help build rapport during an interview. It also can convey respect, consideration for the evaluee's feelings, politeness, and an appropriate level of concern. In this example they gave, say somebody expressed, my mother just died. What they mean by what might be appropriate here would be in response to that, for example, instead of somebody saying, my mother just died, and just kind of, okay, so now we're going to go into the mental status portion, being able to stop and sort of acknowledge that this person is a human being and they just experienced something really awful, and human to human, you can show some polite consideration for that. I'm so sorry to hear that, something like that. Brodsky and Wilson point out that in response to Schumann's paper and his concern about maybe the evaluee misconstruing the relationship as a type of psychotherapeutic relationship, that therapeutic relationship building in general, it's not a part of forensic evaluation. So they didn't think that people needed to maybe be as concerned about that, because those skills really don't translate over, and you're not like consciously bringing those skills into a forensic evaluation. You're not spending a whole initial session, for example, doing an intake, building rapport, getting to know the person. Those sort of rapport building skills that we're taught and that we get accustomed to, those don't tend to come into play. They also highlighted that conveying respect for examinees is necessary and crucial for cultural competency and ethical practices. So again, some appropriate expression of sympathy in the context of somebody reporting that their mother just died, things like that, or actually they convey some necessary respect. And then they also point out that, like in research studies, one thing that we could do is that instead of just stopping with the initial informed consent and limits to confidentiality at the beginning of the evaluation, that it would be okay and appropriate at certain points during the evaluation to remind them that they can opt out at any time, just like we do in research studies. One way that I do this in practice with competency evaluations, for example, is kind of reminding the examinee, there are a lot of questions that I'm going to be asking you today about a lot of different topics and things. Some are personal about you, some are more general questions. It is your right not to answer any questions that you don't want to answer. For a time when I was in graduate school, I was working at a psychiatric hospital and I was conducting intake assessment. So I was responsible for conducting intake assessment for everybody that presented for treatment. Often these were individuals whose symptoms were very acute, individuals who had very, very complex histories of trauma a lot of the time. And so in that instance, it wasn't a forensic evaluation per se, but I would let them know, I'm going to be asking you some questions about some topics that I understand are very personal and can be emotionally difficult to talk about. You don't need to go into excessive detail, and you don't need to tell me anything that you're not comfortable talking about. A simple yes or no in response to some questions would be fine. So things like that, we have the opportunity to remind examinees throughout the evaluation that they can opt out. They also highlighted that it kind of makes no difference. What they mean by that is that research suggests that most of our communication person to person is nonverbal anyway. So their point is, whether you're expressing these things verbally, it kind of doesn't matter, because you're still going to be conveying what you're thinking and feeling to the person, whether or not you're verbally expressing that. They also highlight again that a measured degree of expressive empathy may be not only acceptable, but socially normative. This domino quote was from this research article, and it was a personal communication that they had, where this person said that after 7 years of doing 100 plus evaluations per year, rarely has it happened that a defendant has revealed another criminal act. So kind of highlighting that perhaps the things that Schumann brought up in the seminal paper in terms of concerns about over-disclosure, maybe we are over-exaggerating or reading too much into that concern, and it might not be as present as we're worried that it is. They also highlight that on the reverse, not expressing enough empathy might actually lead to guardedness from examinees, and then that might in turn affect their disclosure of information that's really necessary for these evaluations. So for example, if somebody came to see me for a competency evaluation and I was very closed off, very cold, if they felt like maybe I didn't understand them, or I didn't care, or I was a bit callous, they might not be so inclined to want to share things with me, especially things that often come up in forensic contexts: histories of trauma, histories of substance use, being forthcoming about everything they know and remember about the incident that they were alleged to be involved in, things like that. So Brodsky and Wilson wanted to highlight that, in fact, not expressing enough empathy might have the reverse effect and might not only affect their disclosure of too much information, but enough information at all. They also point out that forensic evaluators have increased accountability for accuracy due to legal ramifications. We, of course, always want to do right by the individuals that we work with and make sure that we are accurate in our reporting and our documentation of information. In forensic evaluations in particular, there are legal ramifications. These are legal cases we're working with. So we really want to be extremely careful in terms of what we're reporting and the accuracy that we are the accuracy of our reporting. And to that point, they propose that the use of empathic questioning may actually assist in gathering more accurate information. Because again, people might feel more comfortable and they might feel like they don't have to minimize information. They don't have to be as guarded. They can be more forthcoming with the evaluator if they feel some empathy from that person. I like this quote that they included that sort of highlights this sort of dichotomy between the use of empathy. So a manipulative empathy intended to break down the defenses of the evaluee, seducing him or her to reveal incriminating information, is a version of psychological trickery that contradicts the ethical principle of do no harm. As an example of the polar opposite of empathy, a manipulative, self-serving forensic assessor might act prejudicially against an evaluee as much as an assessor can behave inappropriately for an evaluee. So again, we just want to be really careful with minding our use of empathic expression and the ways in which expressing it might affect the people we're working with. They talk about this idea of compassionate detachment, which is being able to appreciate someone's feelings without necessarily sharing those feelings. So in a way, kind of going back to the cognitive empathy piece, you can appreciate mentally maybe what somebody has been through without letting yourself become fully involved in feeling those feelings. They caution us to take care not to slip into the healer role, whether we do that or intentionally or not. Melton et al. Said in 2007 that forensic examinees should never be perceived as patients. So our relationship as treatment providers or as psychologists with patients, with clients directly, that's going to look different. And if we start conceptualizing the people that we evaluate as patients, it's going to be really easy to slip into that healer role. I've caught myself internally wanting to do that. So I can think of one evaluation in recent memory I had with an individual who reminded me very much of somebody who I worked with on internship in a treatment role. And so as this person was sharing with me about their history, about their symptoms, even the clinical observations I was making in the room of this person were very, very, very similar to a previous individual that I had worked with. And this is a field where we work with people who are experiencing some very, very difficult situations. So it can be really hard, especially when you've worked in a treatment capacity, not to want to internally just jump into that, oh my goodness, I want to help this person. They're dealing with so much. These things are very heartbreaking, and it's hard not to want to help in some way. And so again, I caught myself internally having these thoughts in the room with this person and really feeling for them. And I had to check that internally and make sure that I was kind of keeping my poker face, not verbalizing any of that information to this individual. And then I processed it with my supervisor afterwards, because I also wanted to be careful about, which would be another topic, but about also my receptive empathy potentially, having an effect on my evaluation. So, that's just one example. I did not express those things to this person, but I felt them, and it would have been easy for me to say, oh my gosh, well, what are your coping skills that you use when these symptoms get to be too much for you? Have you thought about this? Seemingly maybe like innocuous little things here and there, but would have really been appropriate for the context of the evaluation. Brodsky and Wilson talk about run-of-the-mill empathic expression versus over-the-top expression. So while they say that some empathic expression is appropriate, you want to be careful with the levels of expression. So to use as an example, again, that the quote of somebody maybe reporting, my mother just died during an evaluation. Run-of-the-mill might be, I'm so sorry to hear that. I'm sorry you went through that. And then kind of continuing on with your evaluation versus, oh no, oh, I am so sorry. That is the worst. Oh, you must be having the hardest time, really kind of overdoing it with your over-the-top empathic expression. The authors also propose more empirical study on the subject. When I was doing a literature review and literature search in preparation for this talk, I found some really, really awesome, really interesting articles, but I didn't find a lot. So I see their point about, we really do need more empirical study on this subject. And then they also propose using empathy as a tool for effective human interaction. Outside of the articles that I just talked about, some other effects of expressed empathy on examinees that we might want to think about are, how do disclosure of details of traumatic experiences with no time to close the wound? How might our empathic expression maybe lead to a situation like this? What I mean by this is, for example, again, I'll use the example of when I was working doing intake assessment for a psychiatric facility. Again, often I would have individuals come in who I was assessing. It was a very long intake assessment, and we would ask all kinds of things, everything from suicidal ideation to sexual trauma history, physical trauma history. Again, just really emotionally heavy topics. And these were often people who were coming in with pretty significant histories of trauma. So as intake assessors, we had to be very careful that we weren't creating a type of psychotherapeutic space where somebody might feel comfortable opening up about their traumas in great detail, because in that context, we just didn't have time to sit there and close up those things that might come out. So often when people discuss their histories of trauma, that can be very destabilizing for people. So we really want to be careful with what we encourage by our own empathic expression in terms of over disclosure of topics that we don't have time or circumstances to address in the moment. Another example might be anger at the outcome of the evaluation versus a perceived outcome. So if you give the impression to somebody that you're evaluating that you're actually on their side, as opposed to being an objective evaluator, they might think, oh yeah, this person aligns with me. They want this for me. Their report's going to help me out. I'm excited. And then, the report comes back or they get the results of whatever it is, and they are really upset because they had this perception that what you were going to write in the report was going to work in their favor. And that's not always the case. Okay, so now we'll talk about effects of empathic expression on evaluators. So this was an article about by Vera et al. About how evaluator empathy impacts not the examinee, but the forensic evaluator. They do discuss both, so we'll go into that. So the actual goal of this study was to examine evaluee levels of disclosure of information when evaluators express empathy versus when they didn't. So this was a study that was designed to address the very issue that I've been discussing throughout this evaluation. So does the way that we express empathy actually create a situation where people are going to over disclose information that might harm them? Interestingly, the main findings of this study were that a sense of alliance with the examiner does not necessarily affect the levels of disclosure, but their most striking finding here was that expressing empathy seemed to influence the evaluator's perception of the people that they were evaluating. They found through this study that when using expressive empathy, evaluators tended to rate examinees as less psychopathic, more conscientious, and more honest. This was a study, it was a simulation study where the experimenters set up a condition where they had graduate students who had experience conducting forensic evaluations operate as the forensic evaluators. And then they had other students participating as examinees. And they had the same individuals who were conducting the evaluations work in both conditions. So they had them for part of their evaluations, they instructed them, I want you to express empathy when you're conducting this evaluation. And for the other evaluees, they said, for your other evaluations, I want you to inhibit that expression. And they wanted to see what effect that had. They chose psychopathy measures because the authors felt like the things that we pull for in psychopathy assessments would be the very type of information that true forensically involved people wouldn't want to express. And the reason that it was a simulation study and they didn't use actual forensically involved participants is because they didn't want to create a situation where they're potentially manipulating people who are actually forensically involved to actually disclose incriminating information. They found that the current study shows that the same evaluator can view evaluees differently because of a purposeful decision to conduct the evaluation one way as opposed to another. In this instance, using expressive empathy versus not using expressive empathy. Really interesting results. So as you can see here on the left-hand side in the empathic evaluator condition, on all of the items, so superficial, grandiose, deceitful, all of them, they scored individuals collectively as lower on these traits than they did when they were in the non-empathic evaluator condition. Again, interestingly, the same evaluators for both conditions. And then on things down here, personality traits like honesty, humility, emotionality, extroversion, agreeableness, these types of things, when in the empathic evaluator condition, they tended to rate examinees as higher on those traits than when they were in the non-empathic evaluator condition. And then in terms of impression management, these were questions that were asked of the people that were functioning as evaluators. So did they think that their participants were using impression management? Meaning, were they consciously making an effort to create a good impression on the examiner or appear a certain way? When in the empathic evaluator condition, they overall considered that the people they were evaluating were not using as much impression management, which is often seen as a type of manipulation. Reversely, they felt like when they were in the empathic evaluator position, they were able to detect impression management better than when they were in the non-empathic evaluator condition. So I want to talk about this idea of detached concern. So this is another thing that these evaluators or authors brought up. And detached concern, it's a concept that's utilized in medical practice. People use it in emergency departments, intensive care, forensic nursing. And it's again, this idea of more of a cognitive empathy, being able to appreciate what somebody's been through and to have cognitive levels of concern for these people without getting so in the weeds with our emotions and kind of over identifying with them. Detached concern is intended to function as a means of both limiting and managing a provider's emotional distress and for safeguarding objectivity in clinical problem solving. I really want to highlight that piece. We could do a whole nother several talks, in fact, on how empathy can influence our own psychological and emotional health as psychologists. So this is another way that people address that, so that you're not kind of risking vicarious traumatization or taking too much home with you. But in this context, I really want to highlight that detached concern can also help safeguard against objectivity, so that you're not over aligning with people and that might be influencing your opinions. Glancy, Chatterjee, and Miller say that detached concern allows us to continue to use empathy as a tool for getting at the truth, both historical and narrative in evaluative work, while again avoiding over-identification and the impaired judgment and manipulation that can result from something like that. So now, this whole talk has kind of been about ethical considerations, but now I just wanted to talk about ethical considerations specific to psychology. So according to our APA ethical principles for psychologists and code of conduct, our principle 8, verse 1, concerning beneficence and non-maleficence. So does our duty to a judicial process conflict with this principle? In other words, so when we're working in forensic context as forensic evaluators, our client is the court. Our duty is to the court. It's to the legal system. It's not necessarily the person that we're evaluating that is our client. It's the court. Does our duty to the judicial process and answering the legal question that they ask conflict with this principle? So sometimes the results of our evaluations might not necessarily be beneficial to the person we're evaluating. Let's say, for example, I decide that after an evaluation, I'm of the opinion that somebody's incompetent to stand trial. Well, what does that mean for that person? Depending on what state you live in, that person might have to go to a state hospital for restoration. Sometimes institutionalization can be traumatic for people. So in that way, am I in fact harming the person because I did my due diligence to the judicial process? Because now they're in a circumstance where they might experience harm as a result of that. So that's one example. I don't have an answer to this. This is more for pondering, kind of how does our role as a forensic evaluator, how does the idea of empathic expression and what that might do to our opinions about the person, does that conflict? Principle B, so fidelity and responsibility. Can the ramifications of expressed empathy impact our principle of fidelity and responsibility within the forensic arena? Again, as psychologists, we have a fidelity and responsibility to protect not just the people that we're working with, but the community at large. So again, what comes out as a result of our expressed empathy, how might that impact our duties of fidelity and responsibility within the forensic context, our responsibility to the court, to the community, all of those things. Standard 3.06 here regarding conflict of interest. So psychologists refrain from taking out on a professional role when personal, scientific, professional, legal, financial, or other interests or relationships could reasonably expected to impair their objectivity, competence, or effectiveness in performing their functions as psychologists, or expose the person or organization with whom the professional relationship exists to harm or exploitation. So kind of part two there, getting back to sometimes in the forensic context, the results of our evaluations might not be favorable for the people that we're actually evaluating. And so how does expressed empathy, if it were to influence those evaluations that we're conducting and our findings, how does that maybe expose the person with whom we're working to harm? And then how does it relate to this particular standard regarding conflict of interest? So this comes from the APA Specialty Guidelines for Forensic Psychology. So Guideline 2.04 discusses knowledge of the legal system and the legal rights of individuals. So Guideline 2.04 states that psychologists refrain from taking on a professional role when personal, scientific, professional, legal, financial, or other interests or relationships could reasonably be expected to impair their objectivity. So this is very similar to the one that I just discussed in our general APA standard. So again, kind of same thing as it applies to our forensic guidelines here. So in conclusion, I really like this quote. For there is no way that a human being can be a forensic psychiatrist, or for that matter, any kind of examiner of the human condition or mental health professional without having emotional reactions. To do so would not be human. However, what the professional in these circumstances can do is learn how to recognize his or her own patterns of response and be able to understand how these particular responses enhance or impair objectivity, neutrality, or the elucidation of the truth. So really taking stock of our own emotions, our own thoughts, and just kind of being able to reflect on those and how they're potentially impacting our work. Because at the end of the day, we are all human. And I think it's safe to say that at least a large majority of us enter the field of psychology because we empathize and because we want to help people. So I think that this quote just really kind of gets at that whole, what can be a conflict between working as a human being in a context where our human condition might in fact interfere with that work. So that's all I have for you. Here are our references. And then here's the QR code that you can use to fill out the form to get the CE credits for the talk.
Well, thank you so much, Cassie, for sharing all of that. It's been a pleasure having these conversations with you and hearing your thoughts and knowledge. And thanks for sharing all of this and many sides of the coin here. I think a lot of us, like you referenced, focus on that impact of empathy on the person that we're evaluating, but it can affect ourselves too. And just thinking about what purpose is it serving and how does it actually impact the evaluation and the individuals involved. So greatly appreciate all that information. We do have several questions already here. If you have any more questions for our presenter, feel free to enter them into the Q&A box, and Dr. Brown will stay on for a bit to answer a few more of the questions that you have. One question that somebody came up with is about this distinction or clarification between empathy and rapport. So as they notice, it's fairly routine for examiners of all types to establish rapport with examinees. How can such efforts be distinguished from what we might consider inappropriate empathy?
That's a fantastic question. Yes, so empathy, rapport building is very important, not just for a therapeutic relationship, but for an evaluation relationship as well. Some ways that you can do that I've learned over the years and been trained in are one thing I like to do is when I'm conducting an evaluation, to help build rapport, it doesn't necessarily have to be how are you? Tell me about yourself, kind of kind of like what you might see in a therapeutic relationship. But what you can do is you can start with lighter topics. So tell me about yourself. Where were you born and raised? Where did you, start with more of those neutral topics. And in that way, you can convey kind of a respectful relationship, which can help build rapport before diving into more of the emotionally heavy topics. So again, like trauma histories of abuse, or, in forensic evaluations, I don't jump right into questions about their legal circumstances, because those are situations that can come with a lot of guardedness. So really kind of looking at if you use a template, for example, or if you don't use a template and you just kind of have an order of operations for how you're going to do things in evaluation, you can start with more of those questions that can help you build rapport just naturally. Asking questions about themselves is a great way to start. And then before you dive in again to the more heavy hitting topics.
Yeah, sounds like similar to those skills you use and referenced before about the difference between receptive and expressive empathy, and using those skills you have of receptive empathy to like set up an environment that helps establish rapport rather than the overt expression of empathy that
Exactly.
that a lot of your conversation was about here. Yes.
Exactly. Yeah. And I think also kind of like the authors noted, kind of not overdoing it. So not, oh my God, that's so awful, I'm so sorry. You might feel like you want to say that, but just really kind of limiting those over expressions of empathy.
Yeah. So one thing you noted in that final quote there, something that resonates with me, the connection centering that we are human. We play my perspective personally is we play the role of forensic psychologist or psychiatrist, but first and foremost, we are human and everything that comes with that, for better or worse. And somebody asks, can the expression of empathy be turned on and off at will? Or is one person's ability and tendency to be empathic a part of our personality regardless of what we talk about here in recommendations, that we have limited control over?
That's also a really great question. And I think that was one of the initial concerns that Schumann highlighted in that seminal paper about, we're almost conditioned just by, I think he didn't say this specifically in that article, but I think just based on our own empathic traits, I think that kind of primes us for this field, but then also by the nature of our training. Sometimes I think it's very easy to naturally fall into that without realizing it. So in response, I think that in terms of turning it off or on, I think we can be mindful about the ways that we're expressing what we're feeling, whether that's verbal expression or all over our faces, or in our body language. But I think that it does take some self-reflection and consultation with other professionals to just talk about these things and maybe identify areas where maybe we are over expressing empathy in contexts where it might not be beneficial to anybody, and where it might not be appropriate. But yeah, in terms of turning it off or on, I think, with receptive empathy, I'm going to go ahead and argue that might be harder to turn off, and it might be easier to control our actual expressions. And then also in terms of receptive empathy, maybe working on things like, what am I feeling after this evaluation or throughout the week? Is this affecting me? And is that in turn affecting my work? I think those are maybe some things that we can do to address that.
Wonderful. Thank you.
Sure.
I'm going to sort of combine two questions here. Actually, I'll throw one to you and then immediately throw the other one after you've answered, because both are related to this idea of what if you go too far with expressive empathy. So one question more on the person being evaluated side is, how do you pull back if you do have concerns that a client may be oversharing or behaving as if you are a trauma therapist for them in that moment? How do you pull back?
Sure. I think that it can, one suggestion would be having more of a frank conversation about that. So I've I've worked in contexts where some people will employ strategies like, just as a reminder, you know, the things that we discussed in this evaluation are going to be summarized and sent. So kind of reminding them that this is we're working within a legal context, and that the things they say aren't necessarily confidential. Because I think maybe as the evaluation goes on, sometimes it can be easy for people to forget that. So kind of reminding them about that. And then if you find yourself personally slipping into more of that kind of trauma therapist role, maybe just taking a step back, kind of, it's okay to take a pause, even if you're in the middle of evaluation, and just kind of think, you know, how am I approaching this and how might I want to scale back? And then, you know, gently just getting back to the task at hand, not continuing to sort of function within that trauma therapist or healer role.
And that sort of gets to the next question, which was more of the evaluator perspective. Somebody asked if you have found or know of any particular markers that evaluators in training can look at to self-evaluate whether the level of expressed empathy is exceeding what might be ethically acceptable.
Sure. Yeah, I have a couple of suggestions. One of them is to kind of look at how the person that you are working with is responding. Are they responding a certain way after you give certain types of feedback or questioning or what have you? And is that like a marked shift from how they were responding before? And then maybe asking, you know, okay, is it the way that I presented that? Did I say too much? I also, and I learned this just personally, working in this field, really kind of checking in with yourself, especially after. I mean, I think it's important to check in with yourself during the evaluation, of course, but I think sometimes, like I noticed for me personally, this came up years ago. I was working in crisis intervention at a shelter for individuals who were experiencing intimate partner violence. And there was one night I was working at the shelter, and there was a woman who had come in with her child, and the child, very sweet, and kind of hung out with me for the night because I was working in childcare at that time for the shelter. And this child disclosed some pretty upsetting, very adult details about things that they had witnessed in the home over the course of their mom's relationship with their partner. And I thought that I was compartmentalizing everything. And then I remember I got in my car after the shift, and as I'm driving home, I just burst into tears. Like I was ugly crying, and I was so overcome with emotion. And I realized, like, it just hit me like a ton of bricks. And so it wasn't until I had that experience that I realized how very much I was being impacted on an empathetic level by the people that I was working with and the information that I was receiving in that work. And I think, again, especially in a forensic context, we do receive a lot of very, very heavy information. And I think that sometimes we do get used to compartmentalizing it because we have to remain objective, and we have to get the job done, and we have to do our due diligence and our duty. So I think that always checking in with your emotions and just kind of becoming your own patient in a way, and kind of like exploring those, where is this coming from and why do I feel like this? And is this having an impact on my work? I think that's really important.
Wonderful. Thank you. And since we are at the top of the hour, we'll go ahead and just ask a few more questions. This one, I know the last part is any thoughts on this, and I know you have them because you've shared them with me. The idea here is, you know, we also as evaluators are the ultimate gatekeepers of what actually goes into the report. This person says they remind their students just because it was said in the interview doesn't mean it's appropriate to go into the report if it is a disclosure that's not directly relevant to the psycholegal question. Do you have any thoughts on this in terms of like being a gatekeeper of like what you actually put in the report, even if somebody has shared it, perhaps because of your empathy and feeling that like they can disclose stuff to you?
Sure, sure. Yeah, absolutely. I totally agree with that person's approach. And I think we have to be careful as forensic evaluators what we do include. So yes, the limits to confidentiality are different, and we do summarize the information that goes into a report. When you're working in a forensic context, you're really focusing on the relevant information. So you're going to get a lot of information in these interviews, but this isn't like a psychodiagnostic evaluation in the way that you can receive all of that information and all of it in a way is relevant because it tells you a story about this person's history, functioning symptoms, et cetera. To Schumann's point about the issue of worrying about examinees over disclosing potentially incriminating information, we also as evaluators do not want to include potentially prejudicial or incriminating information either. So kind of like with psychotherapy progress notes, how often people tend to keep those vague because while you have to keep notes of patient progress, you don't want to explicitly say things that might be harmful to the person should they ever come out, for example, through a subpoena or something like that. Same thing with forensic evals. You really want to safeguard information that's not relevant to the legal question. You don't need to include it. For example, if I have individuals that ever disclose like gang affiliation, gang history, for example, things like that, you don't need to explicitly include that. Number one, it's probably not relevant to the question. And two, again, you don't want to include anything incriminating anyway. There's a way to report information without being so explicit that you're putting potentially prejudicial details in a report. In terms of how empathy might influence that, I can see a context where, oh, well, I want to really discuss the details of this person's trauma history because that trauma history is impacting, their feelings, and I really feel bad for them, and I want the court to kind of take mercy on them, for example. And maybe if they know that they had this trauma history, they'll be a little more lenient, things like that. Like that would be really inappropriate. You can wish that, but you also want to not express that, not put that in your report anywhere. Relevant details don't need to be, irrelevant details don't need to be included.
Certainly. And to wrap up, one final question here. It combines several people's. A lot of people were asking about expressing empathy for particular types of people that you're evaluating or unique groups. So I'll just throw out a couple that people have asked about. And if you have any thoughts about any of these groups, the impact of expressing empathy with people with intellectual disabilities, how we approach forensic evaluations with adolescents, so not young people, not adults, and how this also considerations of expressing empathy with offenders who evidence particularly psychopathic or sadistic traits. So throwing all those out there, any that you want to consider or address.
Sure. So I think that it kind of goes back to, for me, rapport building. So you can, let's see how I want to phrase this. You can express empathy or show empathy and basic respect for somebody without overindulging in the empathy. So for example, if you're working with children, you can still approach that child in a way that's developmentally and professionally appropriate. So, hey kiddo, how are you? How's, kind of talking to them like at their level, as opposed to going into it like, I am the forensic evaluator, I'm here to. And that's a way that you can build a rapport, also show them that they're in a safe environment to share information with you without kind of overdoing it. And I think that it would be appropriate to interact with different populations a little bit differently, because of course, I think kind of similar to a therapeutic relationship, also an evaluation, you meet people where they're at, and you speak to them in terms that they can understand and that they can respond to. So I don't know if that really fully answers the question, but
well, there were several of them in there. So yeah, thank you so much, Cassie, Dr. Brown, for sharing all of this with us. Very, very important for us to think about when we do these evaluations, especially the goal of being objective, but the idea of how the decisions we make, not just in what we ask, but what we do in an evaluation, how that impacts the work that we do here. And so I'm sure that if any of you are going to be at the American Psychology Law Society conference, Dr. Brown, myself, most of UNM will be there. More than happy to answer any questions or anything about that at that time if you happen to see her. So go ahead and do that. That wraps up this week's Law and Mental Health series. Again, we hope to see you next week when David Prescott will be covering the Good Lives model of offense-related treatment. We hope to see you at the American Psychology Law Society conference for those of you that are there. And until the next time we see you on the Law and Mental Health series, take care. We hope you have a fantastic rest of your week.